what have we done to sort of undo this? The thing that makes us live and continue to renew ourselves are cells in the body called stem cells. Every tissue in the body has stem cells. There's different kinds of stem cells. Stem cells have three characteristics. The first one is that they can make more of each other, so they can go on indefinitely replacing the stem cell. The second thing is that they can become different tissues. That means they can become muscle, bone, they can become fat, depends on what the environment they're placed in. And the third thing is that they have the ability to regenerate and repair tissues. That's what makes up a stem cell. And for over 40 years, we've had a lot of experience using stem cells from bone marrow to treat bone marrow transplants for cancers and other ailments. And over the last 16 years, I've been working on stem cells coming from a person's own fat. So the fat contains a lot more stem cells than the stem cells that are found in the bone marrow. So we don't have to grow them in the petri dish, we don't have to do anything, we can just take it and inject it into the tissues and we can get a very good effect. So that's how I came up with this procedure called the stem cell lift, which is a surgical procedure that I do in my office. We take the fat, we separate the stem cells, and we inject it for different reasons. For cosmetic, for reconstructive, we use it for musculoskeletal pain, we use it for autoimmune skin diseases, and we also use it for wound repair. This is how I came to really believe in stem cell technology and the power of the stem cells. This patient came to me, had cancer, they took out the cancer, they did radiation on his face, and that left him a big hole, a burn on his skin, and a lot of pain from the nerve endings. Basically, the skin was stuck onto the bone that was underneath. There was no blood flow in there, so everything that we traditionally would do to repair this would not work, because as soon as they would try to do any sort of surgery, the skin starts to die and they had to stop. He came to me, we injected him over a course of 2 years, and within those 2 years, I was so amazed how the tissue responded and how the skin improved. And you can see the jawline is better, the hole is fixed, the skin is improved, which is hard to see in the picture, and his nerve pains all went away. So I became a big believer in stem cells, and this is why we're here. Then we use it for cosmetic reasons, and when we were using it for cosmetic reasons, something amazing was happening. Usually it takes months and months for the cells to attach and become part of the tissues. And when you're doing this, you're expecting it, okay, we're going to do this, and in a few months we'll come back and we'll look at it again. But within a few days, within a few weeks, we were seeing changes in the skin. And these changes lasted a long time. I mean, this is a patient that I did about 10 years ago, and she still looks great, and the skin looks great. So we said, what's going on? There's something that's going on beyond what the cells are doing physically. There must be something that they're producing that's causing this change very quickly. So we took these cells into the laboratory and we started testing them. And we grew them in the culture, and that's what they look like when you look at it under the microscope with different fluorescence. And we tested what the cells were producing. And we found that these cells produce a lot of different factors. And these factors have different jobs in the body. So some of them are for inflammation, some of them for oxidation, some of them are for wound healing. And we looked at that and we started playing with it and trying to make a product for healing wounds and burns and of course for cosmetic reasons. So in 2009, Randy and Wendy, who talked before me, walked into my office, and I had the pleasure of meeting them, and Randy had some knee pain. He wanted to see if we can help him with the stem cells. We injected his stem cells. I took a little bit of fat from him, and we injected it. He felt a little bit better, but that wasn't it. We really hit it off and became very good friends. And he said, okay, this is great. What else do you do with these stem cells? So I said, oh, we're developing these products and we have a cosmetic product. He goes, so how many of these do you sell? I got about 40 a month. He goes, how would you like to sell 40,000? Little did I know, he really meant it. So that's how Luminesce came to be and the Luminesce light came to be. And we've developed this process where we call it the APT200. It's advanced polypeptide technology, where these peptides, these are the core of the Luminesce skincare line. And it's unique, it's very difficult to make, nobody can duplicate this, and it's exclusive to Luminesce. So let's talk about what polypeptides are. Everything in the body is made up of amino acids. Amino acids come together and they make peptides. Peptides come together and they make polypeptides. And polypeptides come together and they make proteins, and everything in our body is really like muscles, mass, and bone. Everything is really made out of the protein. So when we test the APT200, this is sort of what we see as a result of the analysis. We see where those peptides are, and that's how we know our product is really what we think it's going to do. And this is incorporated in all the skincare line in Luminesce, which we'll talk about. But today, I want to talk about something exciting. We have a new product we're introducing today, is the Flawless Skin Brightner. I think this is going to be a revolutionary product in the market, because unlike all the other products till now, where we were putting a lot of acids and a lot of bleaching agent to sort of strip away the color, here we're just allowing the body to even out the skin tone without these harsh chemicals. So using the same technology. So let's take a look and see what is the science behind skin color. So if you look on the very top, it's called the stratum corneum. It's what your skin surface is. This is what you see. This is all dead skin layer. And then you go to the stratum base. I don't know if you can see right there, the basal layer. That's where all the stem cells are, and that's where the pigment cells are, called melanocytes. So the melanocytes in darker people produce a lot more color, and lighter people have a different color. When we look at it under the microscope, it's because in darker people you have something called eumelanin, and in light people you have something called pheomelanin. And of course the ratio of that determines how dark you are or how light you are. And there's a whole process that goes on to make these pigments. These pigment cells, the melanocytes, produce the melanin, which is a pigment, and they package it into melanosomes, which are the package where they transfer this pigment up from that basal layer where they sit, up into the skin and into the keratinocytes and up all the way. So the higher it comes, the more visible it becomes, and that's how you see it. And the main function of melanin is really to protect your skin. So if you go out in the sun and you get a sun tan, you're really damaging your skin. And in response to that sun damage, your body is producing more pigment to protect it, and that's really what you're seeing as those pigment cells are producing and coming up through the tissues. There's other factors besides the sun that causes us to have discoloration. There's inflammation, pollution, And one of the most important things is actually hormonal factors, like the mask of pregnancy, or people who are on birth control, they tend to get these blotches on their skin that are from the hormones, and they're very difficult to treat. And what we did was we looked at different ingredients under the microscope. When we put these cells and we put different ingredients, we said, what will happen to the pigment if we put this ingredient in? And we tested them. And we came up with a way of doing the correction, like we talked about the different causes. We went and addressed all those different causes separately. So we have products that actually will go and target the different places where those influences cause discoloration or hyperpigmentation, which is increased pigment. So the Flawless Skin Brightner has a few different ingredients in it that will help to even out the skin tone. One of the important things I want to bring out is that the Flash White Unispheres is a unique product that we put in here, because when you put the product on your skin, you'll see they'll have little white beads inside of it. Those white beads is what is in these unispheres are. And when you rub it on, it basically forms creates a protective field on top of the skin, and it gives you a little bit of a lightening right away. So it gives you a more even skin tone right away, and it will protect the skin at the same time. So when you see that white thing, it's not that the product is bad, it's meant to be there. So the key benefits. Key benefits is that it will even out your skin tone, it will improve the discoloration, and it will maintain that over time. But you gotta still protect yourself from the sun rays and from all the other causes that we talked about that can induce hyperpigmentation. So here are some pictures of my patients who tried it in the clinic, and after 2 months you can see the improvement. This is after 9 months. This is the melasma, which we talked about is very difficult to do. This is after 3 months on the chest, and some of these are actually growths that haven't gone, and we have to burn these off, but the rest of it that got lighter was actually just pigmentation. So that's the new product. And now I'm going to talk about how that incorporates to the rest of the product line. As we talked about, the product line works synergistically. It's got the antioxidants, anti-glycation, the APT200, vitamins, sunscreen, and we're going to go through each one and say how we should use it and what it does. So, we talked about the synergy. Okay. One of the most important things we need to talk about is that although the idea came from stem cells, the product itself, actually no product itself for the skincare has any cells, alive cells in it. Cells cannot stay alive outside the body or in the laboratory. So there's no stem cells and there are no animal products in any of our products. There's no parabens. It's non-comedogenic, that means it doesn't cause you to break out and get acne. It doesn't have harsh chemicals or hydroquinone. And you can use it on all skin colors, on all skin types, on any part of the body. And the more you use it, the more it will improve it. And once it gets to the optimal time of improvement, then it will maintain it. So the first thing we do is we need to prepare the skin and clean the skin. So the Youth Restoring Cleanser will take away the dirt, open up the pores, and prepare the skin for the treatment we're going to do with the rest of the skincare line. So you want to wash the face in the morning and at night. The first thing that should go on the skin right after you wash is the Luminesce Cellular Rejuvenation Serum. Once you put that on, you want to rub it in and make sure that it gets absorbed. So you don't want to just dab it on. You want to rub it in so it goes in. And you do that in the morning and then you do it at night. Once you put it on and you want to test it, like my patient did, only use it on one hand and say, let me see what will happen. So after a month she comes and she was all excited. She goes, look. So then once we have the serum on and is absorbed, then we apply the Flawless Skin Brightener. Again, you can use this morning and night because there's no sun sensitivity. It doesn't have any of those products that makes you sensitive to the sun or makes you irritated. So you can use it morning and night. And after that, in the mornings, you want to protect your skin from the sun rays with an SPF of 30. You get 98% protection from the sun rays. And that's one of the studies I did actually on sun protection about 20 years ago. And at 30, you get a very good block. But if you're going to be out in the sun for a long time, you should reapply it every 2 hours because the protection goes away after a few hours. So if you're going to be out in the sun and you want to protect your skin, then you have to reapply the moisturizer with the SPF of 30 so you get better protection. At night, and this is an amazingly unique product as well because no product in the market today has all the different ingredients that work together like this. It has the APT 200, it has moisturizers, it has antioxidants, and it has the anti-glycation products in there where if you use it, you'll see the improvement in the skin over time. So we want to also have an exfoliator. So the Ultimate Lifting Mask will exfoliate the skin. That means it will take off the dead skin layers and give you a softer, nicer skin. But it also will give you an immediate lift. So when you put it on, the skin will feel tighter, lifted, more youthful. And it's gentle enough. It doesn't have all those chemicals like we talked about. So you can put it on every day if you want. If you want to look at it during the day, put it on in the morning. If you want to look at it at night, you put it on at night. But at least you should use it once a week. And the way you put this on, you put a thin layer on the whole face. You can even put it on the neck if you like. And you let it dry for about 20 minutes. Once it's dry, you peel it off, you wash your face with a little bit of water to get off the residual, and then you can apply the serum and the rest of the products. And for the body and other body parts, we have the combination of the APT 200 and antioxidants and moisturizers for the use on large body parts. So let's review the overall skin regimen. So in the morning, you wash. If you want to do the mask, you can do the mask. Then you put on the serum, then you put the brightener, and then you put the SPF 30 moisturizing complex. And at night, you do the wash. If you want to do the mask at night, you can do the mask. Then you do the serum, the brightener, and then you put on the night repair. So here's some pictures that actually Jeunesse members have sent me. And if you have pictures that you want to share with me, I would love to have them. So please do share your pictures. So here is different patients, different members of Jeunesse family who share these pictures. I met her in Australia, and she goes, "I love your products. This is me and this is my mother." I was like,
January 5th, 2016.
and she actually came up to me. She was so excited how much improvement she had that she became a believer in the products, and she's a diamond now. And what I want to show with all these pictures is that every person is different. Not every person has the same skin type or skin problem, but all the different problems get improved. And the skin texture and the skin tone and the color all get improved.
2 years ago.
Here's another guy who showed me the improvement in the skin that was pretty amazing. And he documented it pretty well. He gave me all these pictures, and I thought
Never
it was
put
very
insulin
good.
just on it, only twice.
So
2 years.
we
Yeah,
saw
it's
my
all serum.
patients using it where we tested it. We saw other people from Jeunesse showing me pictures, but that's not. I'm a scientist. I need to know objectively how good the products are. So we gave it to a lab that tests products and tested for all the different big brands. And they did a test on our skincare line, and usually it takes 3 to 4 months to see changes in skincare. And within 4 weeks, we saw dramatic improvement just in the luminescence, the brightness, the lightening effect of the product. 50% improvement was noted in that study, which is pretty amazing. Then they did a very cool analysis using reverse photoengineering. So they take a picture, then they look at it, and they look to see how much luminescence, which is brighter, how much brighter the skin is. And overall, within 4 weeks, it jumped 132%. That means it's like 100 times, more than 100 times better. So it's amazing. And they took these pictures like this so you can understand what they did. So they took pictures in series and then they looked at them and then they did a calculation. So here's one of those patients that they did, and it was 160% improvement in the luminosity of the skin. So I hope you guys liked this new product. Give me your feedback. This is what I'm hoping to see from, using the product after 3 months. Melasma is getting better. These are very difficult things to treat. So if you do want to share your pictures with me, please do. And I appreciate you coming and listening to me. Thank you.